everyone. As a healthcare professional, do you want to build a trustworthy and healthy relationship with your patients and patients' family? Do you want to be remembered as a fabulous healthcare professional? Are you preparing for NABH? Do you want to create a trustworthy, ever charming, a heart touching, and a beautiful image of your healthcare organization in the hearts of the people in the community? Yes? Then this video is for you. Hello everyone, myself Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. Before moving ahead, a small reminder. If you are new to my channel, please subscribe my channel. And if you are already a subscriber, thanks for motivating me. And if you find the content of my channel helpful for your studies or to prepare for your exams and interviews and easy to understand, easy to learn and easy to remember, then please do like and share my videos. Thank you. So the theme of this video is to create an awareness regarding patients' rights, okay, which is not only helpful for the patient and the patient's family but also for the healthcare professionals and the healthcare organization in achieving higher level of patient satisfaction. Okay, patient satisfaction is our motto. Yes, that is what we say. Okay, so hospitals, we know that for those people who are in healthcare needs, hospitals are the centers of hope and restoration. When a loved one is sick or critically ill or injured, we tend to put a complete trust, a complete faith in the hospital and its healthcare professional that they will treat them well, that they will save our loved ones, that they will bring them back to the normal, okay, that they will restore our family's happiness, okay, by restoring the health of our loved one. Then it is very important that we should be aware of these rights. Okay, so in order to make sure that patients and the patient's family are not physically, mentally, emotionally, spiritually and financially cheated by anyone, okay, and in order to make sure that hospitals are not the source of financial hardship or a source of great distress for the people, the Ministry of Health and the Family Welfare and the National Human Rights Commission has released the Charter of Patients' Rights, okay, which enumerates 17 rights that the patients are entitled to. Okay, so during their stay in the hospital, the patients are entitled to these rights. Okay, so from the time the patient enters into the hospital, during their entire stay and till the time they get discharged and even during their follow-up visit, a beautiful relationship is formed between the patient and the healthcare professional and the organization. Okay, and to make sure that this relationship remains strong and based on the trust, okay, and it goes on well, every healthcare professional should assure that the following patient rights are met. Okay, so every healthcare professional in a health facility should be committed to patients' rights. Let's see one by one what are they. Okay, what are patient rights, by the way? Patient rights are nothing but the subsets of human rights. Okay, as a human we have certain rights. Yes, so as a patient also we have certain rights. Okay, so these rights are nothing but the basic rules of conduct, okay, between the patient and the healthcare professional, the policies and the rules that must be preserved and protected by the healthcare facility towards the patient and their families, and it is very, very essential, okay, if you want to have a good relationship with your patient and the patient's family, and if you want them to visit again or trust you again, and if you want them to refer others to you. Fine. Okay, so let's see what are these patient rights one by one. Okay, now coming to the first right, that is the first right of the patient that they are entitled to during their hospital stay is right to information. Right to information. A patient has the right to obtain authentic information regarding their medical condition. Okay, so a patient has the right to know what is happening to them or what has happened to them, their disease condition, what is the cause, what is the diagnosis, okay, so what is the treatment, what are the methods and options for treatment, what is the expected cost of treatment, okay, so they have the right for information for all these things, okay, in a language that is known to them and in a very simple terms, okay. We should not use medical terminology which they cannot comprehend, okay. So when we are providing this important information to the patient, we have to make sure that it is explained to them in a language which is known to them. Hindi, Telugu, English, Malayalam, Kannadam, whatever, Arabic, whatever is the language known to them, it has to be explained to them in that particular language and in very simple terminology, okay. We should not use much medical terms which they cannot comprehend, okay. So we have to explain them what is their disease condition, okay, what is the cause, what is the treatment, what are the options they have in treatment, okay, and what can be the expected cost of treatment, okay. And in right to information, patients also have the right to know, like who are their caregivers, means their identity, who are the people involved in their care, their identity, their qualification, their professional status, okay. So they have the right to know all this. They have the right to know who are all involved in his or her care, okay, their name and their role. Why we need to give all this information to the patient? It is because for their convenience, for their knowledge, and this information will help them to take better decision, okay, based on the trust, which are not forceful. Fine. So right to information is the first right of every patient, irrespective of everything, who is in the hospital, okay. So they have the right for obtaining all this authentic information. Then the second right that every patient is entitled to during their hospital stay is right to non-discrimination. Right to non-discrimination. That is, every healthcare professional, they should provide equal care to all the people, okay. That means healthcare professional cannot refuse treatment to any patient on the grounds of gender, sexuality, caste, religion, race, place of birth or illness or the source of payment. Irrespective of all the things that I have mentioned just now, irrespective of everything, the healthcare professional should provide the treatment to them, okay. So this is right to non-discrimination. Fine. So they have, like everyone has equal access to the healthcare, irrespective of everything. Every citizen has the right to equal access to the comprehensive basic healthcare. So this is the second right, that is right to non-discrimination. Then the third right is right to medical care in an emergency. Right to medical care in an emergency. This is right to accessibility, okay. That means every hospital, may it be private hospital or a public hospital, every hospital are bound to provide the basic emergency medical care without compromising the safety and the quality, okay, and should be initiated without asking for payment or advance, okay. This is the third right. Every hospital, okay, irrespective of everything, they have to provide the emergency medical care without even asking for the payment or advance. Fine. Like for example, you can say the patient got arrested, cardiac arrest, okay. Then at that time, immediately we can start the CPR or the BLS and the ACLS process without asking the patients or the patient's family for advance or the payment. It's not like you are not able to pay, then we'll not give the CPR, will not start with the BLS or the ACLS. No, it shouldn't be like that. Saving life is the priority, okay. So without asking for the payment or for the advance, every hospital, may it be private or public, they have to start the initial emergency care to the patient. So every life-saving procedure, I mean to say the life-saving procedures, the life-saving measures must be taken to stabilize the patient regardless of the patient's ability to pay for the treatment or not, okay. So this right assures that every patient has the right to access for the healthcare irrespective of their financial status. I mean the emergency healthcare. Okay, at least we can stabilize the patient, provide the emergency life-saving procedure, provide the emergency life-saving care, and stabilize the patient. And then, you know, if they are affordable or not affordable, that can be decided. And if they want to shift to the other hospital, at least stabilize in a condition that they can be shifted to the other hospital. So this is the third right, that is right to medical care in an emergency. Then the fourth right is right to obtain, you know, an informed consent for treatment and the procedure. Okay, so every healthcare professional should make sure that they obtain an informed consent for the treatment and the procedures that they are carrying out to save the patient. Okay, which involves patient's understanding of what the doctor is proposing to do, whether the doctor's proposal is a minor procedure or a major surgery, the nature and the purpose of the treatment, intended effects versus side effects, risk and anticipated benefits, and the alternative options what they have. Okay, so first thing is they need to explain to the patient, we need to explain to the patient what is the treatment plan. Okay, what are the options they have in treatment, what is the anticipated benefits, what are the risks involved, okay, what can be the side effects, what can be the effects. Okay, and all this should be explained in a language that is known to them in a very simple term, and then the patient should be in a condition to give a voluntary consent. Okay, it should not be forceful, consent should not be forceful. Okay, a patient must be competent in order to give the voluntary or informed consent. There are certain factors which can affect the patient capability to give the informed consent, like if the patient is mentally ill or under the influence of alcohol or due to drug intoxication or due to altered mental status or due to some brain injury, or the patient is too young to legally make the decision concerning to healthcare, then that time the patient's family or the surrogates, whoever the proxy, okay, the legal guardian, they can give the consent to the healthcare provider for the treatment. Okay, but the informed consent is mandatory. Okay, for anesthesia, for blood transfusion, for surgery, for any invasive procedure, for many tests, many diagnostic procedures, okay, for whatever, okay, informed consent is mandatory, and it should not be forceful, it should be voluntary consent. Okay, so it should be free from force, it should be free from fraud, and patient do have the right to refuse and ask questions. Okay, so informed consent is very important, and if the patient is not under the influence of alcohol or drug intoxication, mentally stable, then they can give the informed consent. Then the fifth right is right to confidentiality, privacy and dignity. Right to confidentiality, privacy and dignity means medical care should be a confidential medical care. Okay, we have to provide confidential medical care to the patient during their hospitalization. Okay, so the patient and healthcare professional interaction should remain confidential. Healthcare professional should not discuss, should never reveal the patient's information to the others unless there is a risk of physically harming self or others. Okay, so if there is a risk that the patient can physically harm self or others, the patient's information regarding the illness or the treatment or other related issues should not be discussed with any other person in any circumstances. Okay, and the data should be kept saved, and no other person apart from the authentic healthcare professional should have an access to this data. Okay, it should not be leaked to anyone, because this can be misused or someone can take advantage of this. Okay, so that's the reason confidentiality should be maintained, and every patient should be treated with dignity, irrespective of their gender, irrespective of their religion, irrespective of their financial status. Every patient must be treated with dignity. Okay, and related to privacy, their case should not be discussed with others. And one more thing is, whenever, especially for the female patient, they do have the right to opt for or to ask for the female healthcare provider may it be a doctor or a nurse, and if there is no female healthcare provider at that time available, then they should be examined. They can be examined by the male healthcare provider, but in the presence of one female healthcare worker. Okay, in the presence of other female healthcare worker only, a male healthcare provider can examine the patient. Okay, so the privacy should be maintained, the curtains should be kept on. Okay, the patient should be covered properly during their hospital stay, during intra-departmental transportation. Okay, they are conscious or unconscious, they are mentally stable or unstable, whatever is their condition, we have to make sure that their clothing is proper. This is very important right of the patient, right to confidentiality, privacy and dignity. Okay, there can be issues related to this, so that's why we need to be very careful. Please don't discuss regarding the patient's condition with others. Especially we see this when there is a seropositive case. If the patient is HIV positive, HBsAg positive, HCV positive, yes, there is a need that during our handover process, when we are handing over the case to the other healthcare profession, then we have to inform them, but it should not be in a very humiliating way. It should not be disclosed so loudly, it should not be told very loudly. Okay, it has to be maintained, confidentiality should be maintained, and we have to make sure, especially with the female patients, girls, that their clothing, their gown is properly covered, they are properly covered during the transportation, during the examination. Okay, when a male doctor or a male healthcare professional is providing the care, there should be a female present at that time. Okay, so this is very important. Then the sixth right of the patient is right to second opinion. Okay, patient have the right to go for the second opinion if they are doubtful, or if they are looking for some better option, or if they are mentally, physically or financially not prepared for the treatment that is offered, or for the treatment that is planned, then they have the right to go for the second opinion, and the healthcare provider and the healthcare organization should provide them with the necessary records and reports so that they can take a second opinion and satisfy themselves. Okay, so it is very important, right? They have the right for second opinion. They can go for any doctor they want of his or her choice. Okay, then the seventh right of the patient is right to refuse the treatment. Okay, this is also again an important right. The patient do have the right to refuse the treatment, but it we have to understand and make sure that the patient is not under the influence of alcohol or drug intoxication, or mentally unstable. Then during this we have to take the advice or the opinion of the patient's legal guardian or the family member. Okay, so they do have the right to refuse the treatment, and we can still explain them, we can try to gain their confidence. Okay, and still if they refuse, then they do have right to exercise this right. Okay, then the eighth right is right to records and reports. Okay, hospital authorities have a duty to provide the medical records and reports to all the patients and their caregivers. Okay, so patients do have the right to get their relevant medical records and reports for for their knowledge, for their record purpose, for the second opinion, or to apply for sometimes insurance, for insurance, or to apply for a sick leave. Okay, to apply for a medical leave, or for any other reason, or to show it to the some other responsible person in the family, or to discuss it with the other doctor. Okay, so they have the right to get the medical records and reports, so we have to provide to them. This is the eighth right. The ninth right of the patient is right to transparency in rates. Right to transparency in rates. This is to make sure that the patient is not financially deceived. Okay, so the patient, all the cost that is laid on the patient for the services, for the test, for the treatment that is rendered by the medical establishment, they have to provide the proper bills to them. Okay, they do have the right to obtain the bills with proper explanation that for what they have kept that cost. Okay, and they do have the right to compare it with the other hospital settings or the other healthcare providers, and then they can think about whether to go for it or not. Okay, so this is the another right. Okay, then one more important right of the patient is right to patient education. Okay, right to patient education. So patients have the right to receive education about their facts relevant to their condition and healthy living practices. Okay, patients have the right to ask questions again and again till they understand. Okay, till they get the confidence, and we should patiently explain to them with dignity, okay, what is their condition, because patients and the just try to understand these guys. Those people who are in healthcare needs are the people who are in pain, are the people who are under stress. Already health stress is there, then financial burden, emotionally disturbed. Okay, the family life is disturbed, they are under a lot of stress, and a lot of question arises in the mind. Okay, so when they ask questions, please don't get irritated, please don't hesitate to answer. Okay, so please answer to their questions. They do have the right to ask the questions related to their health condition, so please clarify them. And they have the right to refuse. So as long as they are not under the influence of alcohol or drug, then they have the right to choose their source of obtaining the medicines and the test. We cannot force them that you have to buy the medicines from our hospital itself, from our pharmacy itself. No, they do have the right to buy the medicines wherever they can afford. Okay, wherever they can purchase. So so we have to make sure to achieve a higher level of health patient satisfaction. We have to make sure that all these rights are met. Okay, so let's revise once again what are the patient rights that we have come across till now. Okay, one is right to, what is the first right? Right to information. Okay, right to information regarding the disease condition, regarding the bills, regarding the healthcare provider teams, their identification and everything. Okay, then next is right to non-discrimination. Okay, the healthcare provider should provide care to them irrespective of everything. Then right to equal access to healthcare, that is right to accessibility, right to medical care in an emergency. Then right to get an informed consent. Okay, then next, right to confidentiality, right to privacy and dignity. Okay, we have to uphold the privacy of the patient's illness and treatment. Okay, then next is right to medical records and reports. Then right to second opinion, right to transparency in rates, right to safety and quality care according to the standards, right to choose alternative treatment options if available, right to choose the source for obtaining the medicines and the test, right to patient education, and right to refuse the care if they are mentally sound. Okay, so these are the few patient rights that every healthcare professional must assure and should be committed to. Hope it was easy to understand. Okay, so please make sure that these rights, patient rights, are met. Okay, in order to be a very heart-touching healthcare professional and a heart-touching healthcare organization. So healthcare field is not what we say, it's not an ATM machine. Yeah, it's not it's completely different from the other fields. Yes, it's not a business, it's something which is related to life, it is something which is related to emotions. Okay, so we have to be very careful and assure these rights are met. So hope this helps. Thanks for watching, and please motivate me by subscribing my channel, Nurses, the Heart of Healthcare. Thank you so much for watching. Please like and share my videos too. Thank you. Have a good day. Stay connected.